The self-care framework was announced in 2017, and we're now at the point of implementation. Why is it called self-care, and what exactly does this framework entail?
So it's called self-care because it's meant to regulate products that you don't need the advice of a healthcare practitioner. So it has to be a minor condition and it basically has to be self-limiting. So basically it shouldn't last more than 60 days. So we're going to move into a regulatory environment where we can only get approval for natural products for things that are, are really, really minor.
Mm.
And we can't get approval under the regular process, which is meant for the chemical drugs.
Shawn,
And
yeah, go on. Yeah, something else
well,
you want to add to that?
what it entails is we're basically going to start regulating these products, natural health products, in the exact same way as the chemical drugs. So we're going to have to start paying, fees for product licensing. That in itself is going to take away most of the products and likely take away homeopathic doctors and,
Well,
and traditional
let's talk
Chinese
about that for a
practitioners.
minute. These regulations, is that the kind of impact it's going to have on natural health practitioners? Will it inhibit their ability to actually speak to their patients or their clients on certain issues and offer certain things?
Now, the speaking is interesting. So what the changes are going to prevent stores from telling you what's happening.
Okay.
They likely aren't going to prevent your doctors from telling you what's happening. But this cost recovery, where they're going to start charging us even a yearly fee for licensing, let alone going through the licensing process. If you're a homeopathic doctor or a traditional Chinese practitioner, you literally need thousands of products to have an
Hmm.
effective practice. And every supplier of both homeopathic remedies that's in Canada and for TCM practitioners have made it clear they're going out of business the minute cost recovery is in. Now, if your homeopathic doctor or traditional Chinese practitioner cannot get remedies, what use are they going to be for you? So this could be
Right.
an absolute train wreck for those healing modalities that a large number of Canadians are relying on.
What about consumers? How will this affect the average Canadian who relies on these products? And I'm one of them.
Well, I mean, it's interesting because the cost has already shot through the roof since, like, we didn't regulate these products as drugs before 2004. And even then, it took us about 14 years to really get everyone into compliance. South of the border, they're treated as foods, like we used to treat them. So our products are now 3 to 4 times as expensive as the same products in the United States. And lower income Canadians, they can't access natural health products. They're already priced out of the market. You add
Mm.
additional costs onto the manufacturers and suppliers, and obviously costs are going to be passed on to the consumer.
Well, some might argue that these supplements won't be illegal, like you said, but just harder to access as well as being more expensive. Is that the case?
Well, yes, but I mean, when you say they're not illegal, the irony is this exact same products you and I can import from the United States, and they're under no approval process there. They're regulated as foods like we used to regulate them. So we can import them, but a Canadian company, either they won't be in existence because they can't afford the new costs, and they can't compete with the US products. So what are we doing? I mean,
Yeah.
why is vitamin C way more expensive here in the United States, let alone a multi-ingredient product? And yet we are free to import them. They're perfectly legal, but they're not, but our own industry is being priced out.
Wow. So what are the new fines? Do you know exactly what they are and how they will impact the small businesses?
Yeah, so another part of the self-care framework is basically to impose the same powers that Health Canada has and the same penalties Health Canada has for the chemical drug companies on natural health products. Now, the maximum fine for a chemical company is $5 million per day. And if you're a large company like Pfizer, that's probably not even pocket change. Like, is that going to deter you in any way? But there's
Mm.
not a single natural health practitioner or natural health product company that can withstand a $5 million a day fine. So
That's
we're
incredible.
kind of out of the zone where a penalty is meant to get you into compliance and into the zone where it will absolutely destroy anyone. And this is intentional. And so what's happening now is companies are self-censoring to
Mm.
avoid any Health Canada action because Health Canada does not let natural health practitioners and companies share truthful health information with you.
And where do the fees and fines go? Can this money be used really fast?
It's going to be used for actually more compliance. So they're going to
Mm,
hire a whole bunch of inspectors to basically enforce the new regs.
wow.
And it's going to be absolute overkill.
Okay. Well, stay with us. We've got more after the break.